Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we're going to discuss the major cardiovascular risk factors that contribute to atherosclerosis and cardiovascular disease. Understanding these risk factors is important because many are modifiable, meaning patients can reduce their future risk through lifestyle changes and medical management. Before discussing the risk factors, let's first define atherosclerosis. The word comes from two Greek roots. Athero means paste, referring to the fatty material that builds up inside arteries, and sclerosis means hardening. Atherosclerosis describes the buildup of fatty plaque within the arterial wall that progressively hardens and narrows arteries over time. The cardiovascular risk factors we'll discuss all accelerate this process. These same risk factors contribute to all major atherosclerotic arterial diseases, including coronary artery disease, peripheral arterial disease, and cerebrovascular disease, such as ischemic stroke. Other conditions include aortic aneurysms, carotid stenosis, and vertebrobasilar insufficiency. Although these conditions affect different parts of the body, many share common cardiovascular risk factors and benefit from early modification of these risk factors. These are the major cardiovascular risk factors you'll see repeatedly throughout healthcare: age, family history, smoking, physical inactivity, obesity, hypertension, dyslipidemia, and diabetes. Other contributors include poor diet, excessive alcohol use, chronic stress, sleep apnea, and genetics. Notice that most of these are modifiable. While we can't change our age or genetics, many other risk factors respond very well to lifestyle modifications and appropriate medical treatment. As we go through each risk factor, keep one key concept in mind. Nearly every cardiovascular risk factor ultimately damages the vascular endothelium, accelerating the development of atherosclerosis. First, we will discuss age. Age is one of the strongest non-modifiable risk factors. Atherosclerosis actually begins during childhood, but plaque develops slowly over decades. The longer someone is exposed to risk factors like hypertension, smoking, or elevated cholesterol, the greater their cumulative damage. Cardiovascular risk begins to rise around age 45 in men and around age 55 in women, although women generally experience their first myocardial infarction later than men because estrogen provides some protection before menopause. Family history helps identify patients with inherited cardiovascular risk. A positive family history generally refers to premature coronary artery disease occurring in close relatives, particularly parents or siblings. While genetics can't be changed, recognizing this risk allows clinicians to focus on aggressively managing the factors that can be modified. Smoking is one of the most damaging cardiovascular risk factors because it affects blood vessels in multiple ways. It decreases the oxygen-carrying capacity of blood by increasing carbon monoxide levels, injures the vascular endothelium, promotes plaque formation, increases clot formation, causes vasospasm, and increases the likelihood of cardiac arrhythmias. Even secondhand smoke increases cardiovascular risk. Physical inactivity increases cardiovascular risk, while regular exercise produces benefits across nearly every body system. Exercise lowers blood pressure, improves insulin sensitivity, reduces inflammation, enhances endothelial function, decreases visceral fat, and lowers the risk of myocardial infarction and premature death. It is important to note that obesity isn't simply about excess body weight. The location of body fat matters. Visceral fat, which surrounds the abdominal organs, is metabolically active and promotes chronic inflammation, insulin resistance, hypertension, abnormal cholesterol levels, and increased clotting risk. While BMI is commonly used to classify obesity, waist circumference often provides additional information because it better reflects visceral adiposity. Hypertension damages the cardiovascular system in two major ways. First, elevated blood pressure increases afterload, forcing the heart to work harder over time. Second, excessive pressure physically injures the arterial endothelium, creating an environment in which cholesterol can more easily enter the vessel wall and initiate plaque formation. Because most individuals have no symptoms, hypertension is often called the silent killer. It's also important to remember that intermittent episodes of elevated blood pressure shouldn't simply be dismissed as white coat hypertension without appropriate evaluation. These are the current American College of Cardiology and American Heart Association blood pressure categories. One important point is that hypertension isn't diagnosed from a single elevated reading. Instead, clinicians use the average of at least two measurements obtained on at least two separate occasions. As physical therapists, this is important because repeated elevated blood pressure measurements during treatment should prompt referral to the patient's healthcare provider. Let's look at how cholesterol contributes to atherosclerosis. When the endothelium becomes injured, LDL cholesterol enters the vessel wall and becomes trapped. This triggers inflammation, attracting macrophages that engulf the LDL and transform into foam cells. Foam cells accumulate within the arterial wall, eventually forming fatty plaques that narrow arteries and increase the risk of myocardial infarction and stroke. While LDL is often called bad cholesterol, HDL helps remove cholesterol from circulation, making higher HDL levels protective. Chronically elevated blood glucose damages blood vessels throughout the body. Persistent hyperglycemia promotes inflammation, accelerates atherosclerosis, damages peripheral nerves, impairs wound healing, increases infection risk, and can ultimately lead to amputation. Successful diabetes management extends beyond controlling blood sugar. Patients should also maintain healthy blood pressure and lipid levels, exercise regularly, perform daily foot inspections, and wear appropriate footwear to reduce the risk of complications. Let's summarize what we've learned. Most cardiovascular risk factors damage the endothelium and accelerate atherosclerosis. Remember, these same risk factors contribute to coronary artery disease, peripheral arterial disease, carotid artery disease, and ischemic stroke. Early recognition and lifestyle modifications can help reduce cardiovascular disease risk.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.